Why would you need an induction so early? I get people, especially like around 20 weeks, who are like, why would you ever need an induction? I would always refuse that. So why would you need an induction at 37 weeks or so? Let's talk about it. I'm Hillary, I am the pregnancy nurse, and I'm the curly hide behind the website Pulling Curls, where we aim to educate moms from bump to bassinet about having the collaborative, confident hospital delivery that they desire. I am also the creator of the online prenatal class for couples. Today we are talking about why you might need to be induced early. There's lots of different reasons. Now we're not going to talk about all of them, but we're going to talk about the main ones. And if you like these kind of videos, I would love it if you would like this video and subscribe, because it really helps YouTube know what you are interested in, which is having a great delivery, right? Okay, a 37-week induction really has to happen for a reason. At 39 weeks, you can kind of make the choice that I would like to be induced now. That's a whole other video, but today we're going to talk about the reasons why you might get induced. And in fact, at the Pregnancy Nurse, I have a whole post about that. I'm going to put it in the notes so you can get a little bit broader review of the information that's in this as well. Okay, reason number one is that baby is too big or baby is too small. That can happen both ways, and they're usually going to measure that through an ultrasound. It often is how the baby's growth curve is happening. So if the baby has kind of stopped growing, then that is obviously an issue, and we probably need baby to come out because the blood flow that you're giving the baby just isn't working out for them. But if baby's too big, a lot of times that can be a reason for them to induce. Reason number two is that there is too little or too much amniotic fluid. Now this of course is also measured with an ultrasound, although I find it's a little bit better of a measurement than maybe the whole baby big too small. So they go in with an ultrasound and they measure the pockets of fluid, and they can kind of tell how much fluid is in there. You can imagine that if baby has too little fluid, it's important for that fluid to help baby grow and be cushioned as the placenta and the baby and the umbilical cord are growing inside. And if baby has too much fluid, it can overstretch your uterus, and it also can give baby more room to twist and turn around and do things to that cord, which we don't want. Reason number three is one you don't hear a lot about. It's called cholestasis, and it's where the bile duct kind of gets pinched off by your baby. People get itchy palms, itchy other areas. If you have really itchy palms, it's something to mention to your provider, because they're going to want to maybe just do a quick lab check of you. They're usually checking your liver enzymes to see how baby is doing on the inside. Reason number four is preeclampsia. Now, preeclampsia would be a whole video on its own, but it is a condition where the smooth muscle just isn't working right and baby just needs to come out. Usually most people know it because they have protein in their urine and their blood pressure is really high. So those are the things that your doctor's kind of checking in the office. If they feel like those are not normal results, they'll send you into the hospital, or they'll check labs and review them with you in the office. So that's what they're checking for with preeclampsia, and it is often a reason that moms get induced early, because we do need baby to come out as your blood pressure rises. Reason number five is diabetes, either gestational diabetes, type 2 diabetes that you had before you got pregnant, or type 1 diabetes. Because it changes how the blood flow is with the baby, it's really important that we watch that. And if babies a lot of times babies get bigger or they're not growing as well, so diabetes can be a reason that baby needs to be induced early. I know a lot of you might have diabetes and are thinking that you might get induced early, but I am seeing a lot of very well controlled diabetics, especially gestational diabetics, who can go till 39, even 40 weeks if things are really under control. So that's awesome. Reason number six is a previous stillborn. If you have had an issue with a baby not making it full term, a lot of times they will induce you early just because you got a lot of emotions, and also sometimes we don't know what happened back then, and so we would like to prevent anything like that happening this time. So that is a reason that people do get induced early. And then reason number eight is whatever the heck. Sometimes they come in with such different reasons that I've never heard before, but they work. And so a lot of times your doctor will come up with a reason why you need to be induced at 37 weeks. However, being uncomfortable really is not a reason to get induced at 37 weeks. You've got to think that we don't know how cooked that baby is, because your due date is plus or minus 2 weeks. So the baby could actually be 35 weeks, which is really too early to come out, but it could also actually be 39 weeks. So a lot of it will depend on how the baby's doing and things like that. I do recommend that moms try and go as long as possible in their pregnancy. I'm a big fan of going the full 40. I actually went 12 days over with my last one and ended up getting induced. So things happen, but I encourage people to try and wait as long as they can for Mother Nature to take effect, but you also need to make the choice that's right for you in discussing it with your provider. So those are some of the reasons why you might get induced at 37 weeks. There's lots of different reasons why people get induced, but those are some of the most common ones that can kind of help give you an idea of what to expect, especially as you're later into your 3rd trimester. If you like these kind of things, be sure and like this video and subscribe. And while you're down there, leave me a comment on if you want to get induced early or if you did get induced early. I would love to know that down there. And then go ahead and take a look at these next videos that are going to come up, because I think you'll like one of those too.